Welcome to Health Watch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. Today we will welcome nurse practitioner Vanessa Norton, who recently joined Calabash Internal Medicine. Then we will speak with Dr. Thomas Braza of Summit Dermatology and Plastic Surgery. Dr. Braza is new to the area and will discuss Mohs surgery with us. Stay tuned to learn about valuable health topics with Health Watch. Well, welcome to the show, Dr. Braza. It's a pleasure to have you here.
Well, thank you. I'm very pleased to be here.
Well, good. I hear you recently moved to Brunswick County. Is that correct?
That is correct. My wife and I moved here from Atlanta, and we're starting a new job here at Summit Plastic Surgery and Dermatology.
Well, I'm curious, what brought you to Brunswick County?
Well, we decided that we were ready to move to get a nice, more laid-back lifestyle here in Wilmington, Brunswick County area, and we found this great opportunity to join the Summit Plastic Surgery and Dermatology, which is an excellent group that has plastic surgery, dermatology, and then now we'll have Mohs surgery, which is my specialty.
Well, let's talk a little bit about your background and your education. Let's start with your education. Where did you go to school?
Sure. I went to University of Georgia for college, and then Emory University for medical school.
Great school.
Yeah, thanks. And then I continued my residency at Emory for dermatology, and then I spent a year in Louisville, Kentucky, doing my fellowship training in Mohs surgery.
And we're going to talk a lot more about Mohs surgery
Sure.
here in a little bit, but still trying to get to know you a little bit. How long have you been in practice?
About 10 years.
About 10 years.
Yeah.
All in Atlanta?
All in Atlanta.
Oh.
So.
Well, coming here to this sun state, the Sun Belt, boy, I'm sure your specialty is going to come in handy.
Yeah, we'll probably be pretty busy. Lots of people get a lot of sun here at the beach.
That's for sure. What made you decide to join Summit Cosmetic and Plastic Surgery?
We just like the fact that it's a very unique practice in the sense that we'll be the only practice in the North Carolina and South Carolina eastern side that has plastic surgery, dermatology, and Mohs surgery. And so the practice encompasses all of that together, and we work as a team to really help treat patients.
Oh, that's nice. That's nice. Are there any other services offered there at Summit?
Well, it's a variety of things within all those. First of all, we have 3 offices. Our main one in Wilmington, one in Holly Ridge, and then, of course, the one here in Supply.
Where's Holly Ridge?
That's north of Wilmington, probably
Oh.
about 45 minutes, an hour north of Wilmington.
Now, I think that some of the offices may have like an esthetician and
Yeah,
things
so
like that.
so we have an esthetician at 2 of our offices, Wilmington and the Supply office, and her name's Jamie, and she's wonderful. And so she kind of helps with the lasers. We do laser hair removal, treat little veins for lasers, and then we do other like chemical peels and a lot of different cosmetic type procedures.
So, boy, it's really a full service.
It's kind of full service. We
practice.
do Botox, fillers, for like collagen type injections, and then from the dermatology standpoint, we do see all type of rashes, acne, and then I do specialize in the Mohs surgery, which is the skin cancer removal.
Wow, that's wonderful information. But today our focus is going to be on Mohs surgery. Now, I don't have a clue what that is. So I would love to learn about that. So what is Mohs?
Sure. Well, Mohs surgery is a way to remove skin cancers. It was named after Dr. Frederick Mohs, who was from Wisconsin. He was a general surgeon who developed the technique. And what it involves is people coming in the office. We do it under local anesthesia. Patients are wide awake for it. They come in, typically we treat basal cells and squamous cell carcinomas, which are the most common type of skin cancers. And they come in the office, we remove the cancer, and then while they wait, we actually have a lab in our office, and which the cancer tissue gets processed, and I'm the pathologist. So once the cancer is removed and processed in the lab, I look at it under a microscope on a glass slide and check to make sure the cancer's all gone, make sure all the margins are clear.
Right.
And it's all while the patient waits. So it's nice because the patient will know it's all gone that day, because if I do see some cancer left, like in one corner, then we go back to the patient, we take that one little piece of skin we need at that corner,
Yes.
process the tissue again, and I check again, and we keep doing that same process till we get the cancer.
Oh, so it's not maybe the first time.
It's not,
the
yeah,
first
yeah, it's
swipe,
not
you
usually
don't-
all the first. About half the time it's on the first try, other times it's 2 or 3 tries, or some go even longer than that.
Really?
But it's nice because we'll know it's gone. Mohs has the highest cure rate of 99% versus any other type of procedure. And it also saves normal skin. So let's say you have a cancer on your nose where you don't have much skin there.
Right.
You don't want to take a lot of skin. You want to take
Right.
just the cancer with some clear
Oh,
margins.
I see what you're saying.
And because once the area is gone, it has to be sewed back up,
Yes.
to make it look good. Because
And
not
like
only
the
do we,
ear, would that be a?
the ears are commonplace, eyelids,
Oh.
mostly on the face,
Wow.
lips, which are mainly where people get the cancers. But all those areas, you don't have much skin. You're on eyelids, you don't have much skin. Ears, you don't have much skin. So you want to save as much, because like I said, once the cancer is gone, we have to get it repaired, or they call it reconstructed, for everything to
Right.
look good. So I always tell my patients the goal is let's remove the cancer, but the second goal is let's make it look good. So cosmetically make it look good, months down the road.
Right. And so you said you're the pathologist.
Yeah, so I'm the pathologist.
in the lab, then you're the one who looks at it under the
That
microscope
is
and
correct.
determines. So
Yeah.
it kind of all happens at once, and there's none of that going home and waiting for 48 hours
Exactly,
or
exactly.
3 days. To
Yeah, so it's
find
all
out.
done usually in a few hours. We tend to finish everything in the morning, but it is, patients have to sit and wait. We usually recommend bring a book to read, or bring a friend to keep you company.
Right.
But they are awake for the procedure. They can eat ahead of time, and so we try to make it real laid back for them, make it a good experience.
It's like an
'cause
event.
it is like an event, but patients seem to be real pleased with it. And like I said, did it for about 10 years. I've done over about 7,000 cases.
Wow.
Yeah, so
So from the beginning of your career, you began doing Mohs
that's
right
correct.
off the bat?
Yeah, right from my training, where I
see.
did my fellowship training in Louisville, Kentucky, I joined a practice in Atlanta and started doing Mohs.
Uh-huh. And again, the guy who invented this process, what was his name?
Frederick Mohs, Dr. Frederick Mohs.
And he's the one who came up with this procedure?
Yeah, he came up with a procedure. It was probably about 40, 50 years ago. It was a
Really?
while ago.
Uh-huh.
He was a general surgeon in University of Wisconsin, up in Madison, and he had just discovered this way to do this. And at first, no one thought it would work. But then he did multiple cases, tens of thousands of cases, and published his results. And people said, "Oh, this actually does work." And it shows, with a success rate of 99%. And
That's
there's no
amazing.
other treatment that's going to give you a 99%
Really?
success rate.
I didn't realize that.
Yeah.
That's historical. And again, you said what kind of skin cancers would this be most appropriate for?
Typically basal cell carcinomas and squamous cell carcinomas. And there are other rare type of skin cancers that we don't see much of that we can do it for. Not typically used for melanoma, though. Typically we'll treat melanoma a different way than the Mohs surgery.
Uh-huh. And the procedure takes a couple of hours, so the patient can expect to be there like all morning.
Yeah, pretty much all. We start not too early, but we start in the morning around 7:30 or 8, and the patients, most of them will typically be gone by noon or 1 at the
So
latest.
it's an outpatient procedure.
Outpatient procedure, wide awake for it. Most of them drive there themselves, drive home.
Oh, they can drive themselves home? Wow.
Yeah.
Well, let's talk about recovery time. What does that look like?
Sure. Well, once the cancer is removed, I look at what I call a wound or a defect, the spot that was left there after cancer was removed, and we make a decision on what's the best way to get it sewed up so cosmetically gives a good result. And I typically sew up most of what I do. And sometimes, though, if it's real small, we let it just heal in by Mother Nature.
Yeah.
Sometimes you can just sew it up, just a few little stitches and be done. But a lot of times, like on the nose and ears and stuff, you have to do like either a flap or a skin graft. And the point of that is to really move normal skin around into the spot to keep a good shape and contour and function to the nose or the ear or wherever, or the lip, wherever we're working. And so typically we'll do the suturing, then we'll bandage them up and send them home. Now sometimes, if necessary, we have a plastic surgeon on board, Dr. Ed Riccardelli, and he may do the suturing because sometimes they're in areas that are tricky that we want done perfectly. Sometimes the cancers get larger than we anticipated. So we have him as a standby or ready to go if need be.
And that could be done right there in the office following the surgery?
Yeah, sometimes it's done a day or two later,
I see.
depending on where he is that day and where I am that day.
The
But it's
severity
okay.
of the
Yeah, exactly.
wound.
And it's okay to wait a day or two.
Sure.
But we try to get most of it done all in the same day.
I don't imagine there are, but could there be side effects of the Mohs surgery?
I mean, there's basic little things
Just
you get from any
typical.
type of procedure. You can get bleeding, rarely get infection. It can be sore afterwards, but surprisingly not too sore. You definitely get bruising, swelling. Those are normal things. Especially like you work in the face, you can get a fair amount of bruising,
Yes.
but bruising goes away.
Yeah.
And then typically we bring it back a week later to take stitches out and make sure it's healing up good. But recovery is pretty simple. I mean, they just go home. We ask them to take it easy for a few days. I always joke and tell them, don't go run a marathon.
Right.
Don't go swim, in the ocean or anything for a few
Exactly.
days. But just take it easy. But a lot of people go back to work the next day.
Really?
They do have a bandage on though, so they can tell a good story. While they're at work, while they have a bandage.
Yeah.
But people tend to do fine, and then like I said, a week later we take stitches out, and then we just wait slowly over time for our cosmetic result, because it does take usually up to a year for your final result for scarring and
Really?
everything. It looks good at a few weeks, but it'll look better at 6 months. It'll look even better at a year. A lot of times we do it, and it blends in so well you can barely even see the scar.
Wow, that's great information. I believe you're also a reconstructive surgeon. Is that correct?
Yeah,
And do you do all types of reconstructive
Well,
procedures?
the reconstruction I do is from the Mohs surgery.
It's from the Mohs.
Yeah, so I don't do any other major type surgeries. Dr. Ed Riccardelli would handle those.
Right.
And he does more like the face lifts and neck lifts and things like that. But the point of me being a reconstructive surgeon deals with repairing the wound from the Mohs surgery. And that's part of our training and our fellowship.
Is it? And let's talk a little bit about, now you just mentioned facelifts and things like that. What other kinds of reconstructive surgery might your partners at Summit do? Like trauma things, if they were in a car accident?
Yeah, he does some trauma, scar revisions, people who've had some old scars they don't like. And then, we do focus a little more on the cosmetic side. So I know he does like tummy tucks and breast implants, breast lifts, neck lifts, eyelid surgery, which is called a blepharoplasty. And, people just call them nose jobs, but, changing your nose and things like that. So, so that's kind of the cosmetic side of the practice. We all do the Botox and the fillers.
You do that also?
And the fillers are Juvederm and Radius. They used to call them collagen. They don't really use collagen anymore. But these are all these newer fillers that people really like.
Let's talk a little bit about your practice now. Are you going to be based mostly in Supply?
Yeah, so I'll be in Supply 3 days a week, and I'll be in Wilmington twice a week.
I see.
And our Supply office is open Monday through Thursday, and we're staffed there every day, and I'll be there 3 of those days, Monday, Tuesday, and Thursday. That's
Monday,
the plan
Tuesday,
right
and
now.
Thursday. That sounds good. And if there are folks out there who would like to speak with you more about this or have a concern about something on their face, how might they get in touch with you?
Sure, they can definitely call the office.
And we'll put that number on our trailer at the bottom of the...
Excellent. So the number will be there, and then we also have a web page, and it's summitcosmeticsurgery.com.
Okay.
And that's our web page, which has all the information. And then from there, they can find the numbers and call. And we're training everyone to be able to explain things and tell patients about what to expect when they come for Mohs surgery and just what our whole practice offers.
Well, yes, because that's a new concept here locally in this county. I believe you're the first surgeon to provide that service. So, as I said, with the sun and the Sun Belt here, I think there'll be a great need for that. And it sounds like the easiest way to go and the most effective.
Yeah, it is. It's great. And like I said, patients, after it's all done and the sutures are out, they appreciate it.
I'm sure.
And it is nice being the first one here. We'll introduce it to everyone, and we like to make it a good experience for them. Because whenever you hear skin cancer, you get worried.
Absolutely.
The types we treat, basal cells and squamous cells, are very treatable. Most of the ones we see are caught early. They're not melanoma, which are the more scary type of skin cancer. But we take care of them. We try to make it a great experience for them. And then we definitely emphasize sunscreen, hats,
Absolutely.
Clothing. So hopefully they'll avoid getting any more in the future.
Yeah, wow.
But unfortunately, being around the beach, lots of people get a lot of sun.
That's true. That's true. Well, we welcome you and your family here to
thanks.
Brunswick County.
We
We're so
appreciate
happy
it.
to have you here.
Yeah, we're very excited about our move down here.
It was a pleasure to have you on the show today, and I hope that I don't have to see you in the office.
Yeah,
but
hopefully not.
But I do hope to
I'll
see you
hope to
again.
see you at the grocery store. So.
I hope I'll see you in the grocery
Yeah,
store.
that's the best place.
All right. Well, thanks again. It was
Sure,
a pleasure.
I appreciate it. I appreciate it.
All right.
All right.
Welcome, Vanessa. It's such a pleasure to have you here today.
Thank you, June.
Now, I understand that you recently joined Calabash Internal Medicine. What brought you to that practice, Vanessa?
Yes, I did join Calabash May the 1st of this year. After my husband and I relocated to the coast from Charlotte, North Carolina. I had been with Novant most of my career.
Really?
And when I saw the Calabash practice and met Dr. Moretti, I knew it was going to be a good fit, and so that's how I landed there.
Oh, well, that's wonderful. So had you moved here first and then found Dr. Moretti's practice, or did you know about it before you came?
I did not know about it before I came.
Really?
We had bought a home last June on the waterway for a vacation home while we lived in Charlotte, but we had our home on the market in Charlotte, and when it sold, we just decided that we would follow our hearts to the beach, and it all worked out, and so that's how I landed at Calabash Internal Medicine.
That's wonderful. Great story. Well, I'd like to start off by learning some more about you, about your background and your education, things like that. Let's start off where you went to school.
Okay. I entered nursing school right after high school at Presbyterian Hospital School of Nursing.
Wow.
I graduated with a diploma in nursing just about the time that diplomas in nursing became obsolete. So my next stop was Queen's University.
Oh, great school.
In Charlotte, and that's where I got my bachelor's in nursing. And it was actually in that program that I began to fall in love with nursing and really embrace the professional aspect of nursing and realized how many options there were, and enjoyed consuming research and kind of understanding all that, how that could mold practice. And then after working a year or so with my bachelor's, I decided to go back and pursue my master's. So I did that at the University of North Carolina at Charlotte. I got a degree, it's adult health nursing, and I took the certification exam to become an adult health nurse practitioner.
Wow, it was a long trip to get where you are.
Well, I call it the scenic route. I mean, the scenic route. I did take the long way there.
And we're so glad that you did. You said you moved from Charlotte. Are you a native of Charlotte, or are you originally from this area?
Well, I was actually born at Presbyterian Hospital.
Really?
And actually grew up close by in Mooresville, North Carolina.
Sure, I know where that is.
And but then when I came to Charlotte to go to school, I stayed, until just this February.
Really?
We actually sold everything in Charlotte and came down here full time. So no, this is a new adventure, a new adventure.
The next chapter of your life.
Yes, yes.
And what made you join Calabash Medical Center? Was it the practice and Dr. Moretti? He has such a great manner about him. I'm sure that had a large part to do. Is that the kind of practice you were looking for?
Yes, because I've actually worked in family practices before.
I see.
But because I am an adult nurse practitioner, sometimes by accident people would put children on my schedule, and I wasn't trained to do that. So it was always just a little inconvenience for that to happen, and I thought ideally internal medicine would be wonderful. And so when I saw the Novant practice in Calabash, about the same time, one of my neighbors told me that he saw Dr. Moretti, and he just had all kinds of really good things to say about Dr. Moretti. And sure enough, when I met him, we clicked. We are a terrific team. We have a good time together, and we have very similar philosophies of health care and patient care, and we have a really nice time practicing together.
That sounds wonderful. It sounds like a place I would want to go. For viewers out there who may be new to the term, explain what it means to be an internal medicine practice versus a family practice, for instance.
Well, the obvious difference would be the age of our patients. We take care of adult patients, and also sort of specialize in adult care, and even to the geriatric years.
Really?
Our oldest old. You know, there are certain conditions and diagnoses that tend to occur at certain ages. So you have the pediatrics that take care of the children, and women's health care specialties, but our specialty, internal medicine, is for adults and our elders.
Well, that's really helpful, Vanessa. And going along with that line of thought, tell us about some of the types of services and procedures offered at Calabash Internal Medicine.
Well, we provide ongoing care of patients with chronic diseases such as diabetes, hypertension, arthritis, things along those lines, the chronic diseases. We also provide acute care when someone just gets a sinus infection or a stomach ache or something like that, back pain. We have a lot of patients who need those services. We do keep some appointments available each day for patients to call us, and we can work them in.
Oh, same day?
Same day. We anticipate that with our patients because...
So if I'm a patient of yours and I've cut my finger, and I can just give you a call. I'm chopping onions or something, and I can just give you a call, and you'll see me that day.
Well, we
provided I'm a patient of yours.
Exactly. We do save spots on both my schedule and Dr. Moretti's schedule for that.
That's great. Well, I'm curious, are there do you remove sutures and things like that?
We do. We suture and remove sutures. We inject joints. We do EKGs, pulmonary function studies. We have a laboratory on site.
Oh, you do?
We do.
So you have the results right away?
In some cases, we do have results right away, but we partner with a national lab, but the blood work is, the blood is drawn specifically for what we order in the office. So the patient doesn't have to go to another place to have their blood drawn.
Right.
We provide...
well, do you provide women's care? Because I know that a lot of times you have to go to 2 or 3 different physicians to get, being a woman, you might have to go a couple places to have certain things done. In terms of that, what kind of services do you offer?
Well, we do now provide women's care.
Really?
That's one of my areas of interest. I really enjoy working with women to keep them healthy. I do pap smears, breast exams, do sort of a well woman visit where we just kind of go through all the recommendations based on her age, and I've found our patients are very receptive to that.
I'm sure they are, because it's so much more convenient for them to have that all done in one place. And then you have the total picture.
Exactly.
You can better care for that patient because you've got all the information. That's a great, great service to offer the women of Brunswick County. And this time of year, I'm thinking about immunizations. You know, we're getting into the fall. Talk to me a little bit about what immunizations you might provide at Calabash Internal Medicine.
Well, it's several are recommended by the CDC.
Really?
We provide pneumonia shots.
Oh yeah, I've read about that.
We provide flu shots. We recommend and write prescriptions for our patients to get the shingles shot. Patients over 60, the CDC recommends a shingles immunization.
Is that connected with chicken pox?
It is. It's, if one has had chicken pox at an early age, we would be at risk for developing shingles later.
I see.
Our immune system keeps that virus in check, but sometimes we go through a period of our life where we're under stress, maybe some illness or something stresses the body, and the chickenpox virus reappears as shingles. So the shingles shot drastically reduces the chance that that would happen by boosting our immunity to the chickenpox virus. The CDC also recommends that adults get a pertussis vaccine, and that comes packaged. We get it at least once in our adult life. When we need to get our tetanus booster, the CDC recommends that it be a tetanus that also includes pertussis.
Now, what is pertussis? What does that?
Pertussis is commonly known as whooping cough, and nowadays we're seeing little outbreaks of whooping cough. Sometimes because people are not immunized as recommended for various reasons. And
If you had whooping cough as a child, might you be able to catch it again in your adult life if you're not inoculated? Or
well, whooping cough is not, most of us haven't had it. It's something that would be a little rare, but the antibodies to whooping cough are not as enduring as some of our other antibodies.
Really?
So we had to have the vaccine when we were children, but the thinking is that those antibodies have disappeared, and that's why we need to re-inoculate ourselves, boost our immune system to learn that antigen so that we can fight whooping cough if we get exposed to it.
would that be a one-time shot like pneumonia you get at once? And
We do. That's what we think, and I'll have to say that the recommendations do change, so stay tuned. But as of today, that's what the CDC has recommended.
Now, if you admit your patients, I'm assuming you admit most of those to Brunswick Novant Medical Center, and do you utilize the hospitalist services there at the hospital?
We do. We do. And I have had an opportunity to work with them a couple of times since I've been here, even in this short time period, and they're wonderful. I can so easily get them on the phone, explain what's happening with our patient, and we get them seen very quickly, and there's good communication between
That's
our
important.
office and the hospital. So nothing but the highest praise for our hospitalists.
It's wonderful. Now, the big question is, are you currently accepting new patients?
We are accepting new patients.
That's good to know, because a lot of the practices in the area are closed. They just have so many patients, you know, they have to stop taking them at some point. And so it's good to know that your practice is open for new patients.
Exactly.
And so if one of our viewers would love to have an appointment with you, how might they do that?
Well, our number they are welcome to call is 910-579-8363. We're right in downtown Calabash. Easy to see us. We're right across from all the restaurants.
Oh, well, that's an easy that's an easy way to find you. And they can just ask to have an appointment with you, Vanessa, and or Dr. Moretti.
Correct.
That's great. Well, Vanessa, I've really enjoyed meeting you today. It's been a pleasure to have you. I hope to have you back real soon, and we'll talk about some of your special interests.
Thank you, June.
Great. Thank you for tuning in to ATMC TV's Health Watch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.org. atmc.coop. I would also like to encourage you to visit Brunswick Novant Medical Center's website at brunswicknovant.org for more information on the hospital, local doctors, and a comprehensive health library. Thank you again for joining us today. Be sure to join us next time for Health Watch on ATMC TV.